Hello, Dr. Jayashree Todkar here, laparoscopic and obesity surgeon. We are going to discuss today about how to control obesity scientifically. Obesity is a disease and it is not just a choice. It behaves biologically and not mathematically. That is where only the calorie count or expenditure of the calories with exercises doesn't work equally in all the patients. For this, we need to understand what are the stages of obesity and how to control it scientifically. As per the recommendations by the scientific organization like International Federation for Obesity and Metabolic Sciences, the obesity should be treated as per the stage of obesity. So what are the stages of obesity? Up to the BMI of 25, it is normal weight. For Asian Indians, up to BMI 28 is the overweight stage. 28 to 32, stage 1. 32 to 37, stage 2. 37 and above, stage 3. Obviously, all stages will not have the same response to the same treatments. So the treatments vary. Up to the BMI of 28, if it is not associated with any other major illness, dietary changes and good physical activity on regular basis help the person come back to the normal weight and a better health. From 28 to 32 BMI, a lot of diseases start creeping up inside the body, and that is where the body may not be able to give you the good results despite of sincere efforts. At times, as we discussed in our previous few discussions, if the pre-diabetes is there, typically all your attempts to lose weight starts failing down. So in this phase, medical treatments in terms of some medications, pharmacotherapy, along with dietary and physical activity changes are recommended. After the BMI of 32, if you are associated with any of the diseases which we have discussed till date, associated with obesity, then you are a candidate who should undergo bariatric surgery to make the metabolism better to deal with the energy. So it will help you burn more or use more at the cellular level than the storage of the calories. After the BMI of 37, even if you are not a candidate with any label disease, you are a candidate for bariatric surgery because there will be n number of impending diseases which can lead to a serious progression to serious complications of the body functions. These are the operations which are different from just removing fat. Fat removing operations like liposuction, tummy tuck, abdominoplasty are not the operations for obesity. These are the operations with a cosmetic agenda with some shaping on a short-term basis designed. These operations do not control the fat manufacturing system or the fat storage system, and that is where, as a treatment of obesity, these operations fail. The operations which are done for the treatments of obesity are done on the digestive system. We are going to enclose the various operations in animated format for your understanding as to how they are done and exactly what happens inside. Multiple types of operations are existent, but they have got three basic principles. In some operations, we try to restrict the intake of the food with some band or maybe a bangle-like device planted on the stomach. The second operation is where we remove a part of the stomach. This operation will change the equation between the storage hormones and the calorie burning hormones, and that is where this equilibrium will be restored for the normalization, and patient will start losing weight as well as the multiple diseases associated with it. The third type of operation has got some malabsorption elements, where the part of the stomach is directly connected to a lower situated small intestine. Which type of operations to be done in which patient, depending upon multiple factors: the age, the BMI,